But I wanted to begin with where we are today, this degree of uncertainty. And Teresa, maybe we can start with you, just addressing the opportunity that you see existing within that uncertainty, and what you see the smartest businesses doing right now as they evolve in this moment.
Yeah, so thanks for having us. It's great to be here. What we're seeing is obviously everyone, to a person, I think, took a pause in March and probably April. But what we've seen, and Heather will talk more about some of the specifics at Solv, but what we've seen with some of our best founders and our best companies is they took the chance for that pause to look at what was happening that was potentially positive and creating new opportunity. I know positive sounds like a strange word to use during this economy, but it turns out, for example, in many areas like digital transformation, everyone is working from home now. So many CIOs would say the IT stack has been pulled forward 5 or 10 years because it had to be. They were all in various states of digital transformation. So we see that with our infrastructure companies, in our security companies. And then I think Heather can talk specifically about the businesses that Solv Health is doing and the services they're providing that are very important in this time to consumers, that frankly did not exist even in January of 2020, let alone in 2019.
That's yeah, right. Heather, I can't think of a better positioned company than yours, frankly, in the midst of great crisis.
Well, yes, thank you, Rebecca, for having us. I will tell you that was not entirely clear in March. When what Solv does is we connect consumers with high quality healthcare with visibility on cost. And what happened for us was back in late February, it was the last week of February, early March, we got a call from one of our partners who is the multi-care health system in the Seattle area. And if you recall, some of the first news that broke on the pandemic was out of a nursing home in that area. It happened to be less than 1 mile away from our partner. And so at Solv, we got a firsthand, very early look at what the impact would be and how quickly it would move from something we read about in the headlines, frankly, to something that every American across the country was facing every day. And so, when you talk about how to look at a moment like this, for us, it stopped by just taking a look and recognizing what is happening around us and how quickly can we adjust in order to solve the problem at hand. In our case, that came ultimately in 2 main forms, right? The first form was, as Teresa said, digital transformation. In many ways, a silver lining, if you can have a silver lining, of the pandemic in the United States is it pulled the future forward in terms of American healthcare. And so telemedicine, as an example, has been on every provider's innovation list for the past 10 years. But with no action because there was no pull either on the provider side or on the consumer side. And as an example, we conducted 9,000 telemedicine visits in all of 2019, inconsequential, right? And in 2020, between mid-March to today, it's at roughly 1.1 million as one example. The other example I would give you in terms of the moment is our mission is to empower consumers in their everyday healthcare. And what we realized very quickly was what that meant in this moment was visibility and access to COVID testing, right? Unfortunately, Americans can't agree on mask wearing as a policy, or there's a lot of confusion around what is social distancing, but the area where you're seeing universal agreement is if there is testing capacity, and if I can get that and I know how much it's gonna cost, consumers are willing to do it. And so an example there is, we've conducted roughly 2.5 million COVID tests connecting consumers to testing across the country, which last month, I think we represented roughly 2% of that. Both of those things are not things we could have anticipated in 2020, but really were a matter of us taking a step back, looking at the moment that we're in, and understanding how we could deliver our services to consumers and providers in this moment and consistent with our mission.